In the name of Allah, the most merciful and the most compassionate, and Prophet Muhammad, peace be upon him. Hello everyone, my tutorial today is about otoacoustic emissions. Let's move on. First of all, what is otoacoustic emissions? Otoacoustic emissions are sounds measured in the external ear canal, reflect movement of the outer hair cells in the cochlea. Otoacoustic emissions are non-invasive and simple to record, requiring few minutes for both ears. Sedation is not indicated for otoacoustic emission measurement, even in children. The procedure is not affected by the patient's motivation, attention, or cognitive status. A soft disposable prop tab is gently inserted into the outer portion of the external ear canal. The stimuli vibrate the tympanic membrane, and mechanical energy is transmitted through the middle ear to the cochlea, then propagated back through the middle ear system and as sound into the ear canal. A mic within the prop detects otoacoustic emission. This is how otoacoustic emission response detected. This is a probe of the otoacoustic emission in the outer ear. So, what are the types of otoacoustic emissions measured clinically with FDA-approved devices? We have two types: transient otoacoustic emission and distortion product otoacoustic emission. What about the transient otoacoustic emission? Transient evoked otoacoustic emission are elicited with very brief transient sound, such as clicks or timbres. The level about 80 decibel SPL. Transient evoked otoacoustic emission reflecting cochlear outer hair cell activity. Transient evoked otoacoustic emission recorded over frequency range of 500 Hz to 4 kHz. The transient otoacoustic emission present in 98% of normal hearing subjects and absent in sensory hearing loss exceeding 30 decibel HL. Females have larger transient evoked otoacoustic emissions than males. The smaller size of the female head and ear canal. Right ears tend to have larger transient evoked otoacoustic emission levels than the left ear. This is a trace of transient evoked otoacoustic emission reflecting past, and as we see here, the signal to noise ratio is more than 3 decibel. And this is not pass-fail transient evoked otoacoustic emission, and the signal to noise ratio is less than 3 decibel. Let's move on to distortion product otoacoustic emission. Distortion product otoacoustic emission are elicited with two pure tones frequencies, F1 and F2, presented simultaneous at moderate level 65 decibel SPL. Distortion product otoacoustic emission can be recorded across a frequency region of 500 Hz up to 8 kHz, and sometimes even higher frequencies. It is present in 90% of normal cases and absent if sensory hearing loss exceed 45 to 55 decibel HL. This is the distortion product of acoustic emission pass. The signal to noise ratio is more than 6 decibel, and this is this distortion product of acoustic emission. The signal to noise ratio is less than 6 decibel. What about the clinical applications of otoacoustic emissions? First of all, reduction of pure tone threshold in infants, young children, mentally retarded, bilingual, and to monitor in occupational noise, in noise exposure, and in ototoxic medications to monitor the damage of the cochlea. And also it is used in newborn and neonatal hearing screening. Neonatal hearing screening either pass or fail. What about the risk factors of neonates? Family history of sensory hearing loss, neonatal intensive care unit more than 5 days, hyperpluropin, ototoxic medications, and very low birth weight, less than 1.5 kilograms. In utero infection like thrush infection, craniofacial abnormalities such as hearing loss, very low Apgar score, mechanical ventilation, and bacterial meningitis. Otoacoustic emission also used in tinnitus and hyperacusis. Otoacoustic emission are abnormal or absent in the frequency region of the tinnitus, even in person with clinical normal audiograms. And also it is used in a deuteroneuropathy spectrum disorder to diagnose that case, the neural disorder, and it's present due to normal cochlear function and absent ABR. Otoacoustic emission with suppression mediated by olivocochlear pendule. And limitations. Limitations of the otoacoustic emission response affected by noise. The absence of otoacoustic emission doesn't reflect the actual hearing loss. Maybe mild, maybe moderate, maybe severe or profound, or the site of the disorder. Abnormal middle ear condition result in absent otoacoustic emission, high referral rate in neonatal hearing screening, and it doesn't detect the nerve or auditory brainstem pathway. Thank you for watching and see you later in the next video. Peace and Allah's mercy be upon you.